Hi, my name is Dr. Fernando Bonnani. I'm a board-certified surgeon and the director of the Blessing Bariatric Institute. The single most important event in my life happened really early on. I was 17 and I joined the military, and I happened to get a job drawing blood in a hospital. And after training, I was waiting around one day and got a phone call to come to the emergency room. I called to a case where a 8-month pregnant woman who was 8 months pregnant had been shot 22 times. It was pretty devastating for me, and I drew her blood. But the surgeons came in and saved her life. They did an emergency C-section, saved the baby, and then proceeded to save her. And it was after that experience that I knew that I needed to be part of helping people. I think the most rewarding thing for me is the doctor-patient relationship. It really is satisfying to see a person who couldn't play with their grandkids on the floor or walk out to their mailbox or just do the simple things that many people just take for granted they can't do. And we just change their lives so incredibly and so quickly. The obese patient in our world is really not treated well, not thought of very highly. In fact, it's probably the only form of prejudice that we see every day that we accept on our TV screens and in our commercials. So to see them transform is just, I mean, it's addicting. When I first came out into surgery, my practice was very diverse and I was very busy, and I really couldn't do bariatrics because I was doing so many other things. But it always stuck in my mind. And I had a nurse in the hospital I was working with convinced me to do her bariatric surgery. And after I did that, it was just, I got hooked. And I got hooked because it's the most rewarding, I believe, it's the most rewarding surgical practice that you can possibly experience, because we're very close to our patients. We spend a lot of time before surgery making decisions on which surgery, choosing the right surgery, getting them prepared, educating them, doing preoperative studies and procedures, and then going to surgery. And then we follow them for life. And they just basically become your friends. You know, you get a chance to be a surgeon and do, you know, highly complicated and sophisticated surgery, but you also get to be a family doctor. And that's a doctor-patient relationship that you just don't get to experience in a lot of surgical specialties. And so, you know, I got hooked. On my 26th patient, that was it. Not that I gave up other surgeries, but I really am focused on bariatric surgery.